I'm Nurse Becky, and I'm here in my Utopia Hospital. Today I'm going to be initiating an IV, a peripheral intravenous infusion. First I'm going to start with my 6 rights, my 6 patient rights, which is the right patient, my right drug, the dose, the right time, the right route, and the right documentation. I'm going to double check my MAR, making sure for the orders for my patient, as well as taking the correct protocol for safety and washing hands and hygiene, washing hands, donning gloves, and that. When I enter the room, I'm going to knock and introduce myself and double check with my patient via 2 methods and have them repeat or ask them their name and their date of birth. According to my MAR, I'm going to be admitting, the patient's been admitted for rehydration and antibiotic therapy. First of all, we're going to initiate the IV of normal saline of 0.9% normal saline at 1,000 milliliters infused over 6 hours. So our drop indicator is going to be, we're going to calculate this, per our solution set is 10 drops per milliliter, and 1,000 milliliters we have, and so that will be 167 milliliters per hour, which breaks down to 2.8 milliliters per minute. And then with the 10 drops, that is going to give us 28 drops per minute, which is about 7 drops per 15 seconds. And so when I put that up, we will calculate that, making sure it's administering correctly. So when I pick my solution, I'm going to double check, looking for any particles or anything that could be discoloration, the expiration date, as well as the lot number. And I will write on the tab that I'm going to be putting on the solution bag the patient's name, the type of solution, the room number, the date. I will initial it, also the bottle number or the lot number. As far as the dosage goes, I will put that it's 28 drops per minute at 6 hours. And then at the top here we have the starting time of 13:05 and the ending time of 19:05 per the MAR. So since everything looks good, I'm going to go ahead and open my solution. And I'm going to open up my flow set. And when opening these, wanting to make sure that everything is intact, and I'm also making sure to keep the clean ends clean. I'm going to first shut off, close the valve so that we don't have solution flying everywhere. And then to spike, when I pull off the tab from both of them, I'm going to make sure that I don't contaminate them by touching or anything. If I do, I would have to start over with new supplies. All right, once I've got that in there good, we'll go ahead and hang it. And again, not allowing the end of it to touch the floor. Then I'm going to apply my label, lining up the 0. There's an arrow for the 0, so where it starts. I'm going to do it on the back side, just there we go. And then I'm also going to label my tubing. And tubing is good for 24 hours, so this will change, even though the sticker says the wrong day. I've written, and you would make sure to use the right sticker. I've written today's date so that they'll know, and then the time of it, and initialed it as well, so that it can be changed at 24 hours. All right, then I would educate the patient as well on the procedure today of what we'll be doing, which is an IV, starting an IV on them. I would go in and we're gonna just first go in to palpate, check out the vein, see that we've got a good location. So to do this, on a normal arm, the arm would be longer, and you would put the tourniquet about 5 to 6 inches above where you're going to start the IV. In this case, it's a little closer than I need to, but we're gonna work with it. So again, I would double check with the patient. Could you state your name, your date of birth, verify it with their name band. Once that's verified, I'm gonna go ahead and place the tourniquet on, making sure that it is tight. If you were to do the location in the arm, you would just make sure to palpate the radial pulse to make sure that you don't have it on too tight, that they're actually still getting some flow through their vein. So then I'm going to palpate, looking for a good vein that is going to be able to withstand the needle, which again, for this patient, you would want to verify the needle size depending on the age, what you're infusing, making sure that the needle is an appropriate needle. Today we're going to use a 20 gauge on this patient. So once I've located it and made sure that it is going to work for our needs, I would then go ahead and remove the tourniquet and go get my supplies. Oh dear, we didn't tie down our plant. Okay, we're good. Sorry. So once I get my supplies, then I'm going to wash my hands, enter the room, identify the patient, explain what we'll be doing. So I wash my hands. If we need to pause it for your little one, you just tell me. Okay.
Well, here, let me pause it really quick and